Hey, beautiful people. Welcome to the Nurse Doc Show. I am Dr. Wesley D. Willis. So, welcome back. Before we jump into the show, I'm going to ask that you like, subscribe, and comment on our show today because the more you like, the more you view, and the more you comment, the more I get paid. So, so yes, definitely also share with everyone that you know, and because this is hopefully going to be a really exciting episode to help us get back into our rhythm. And today's show was we'll talk about coping with trauma and daily stress by using mindfulness and meditation techniques. A lot has happened since again my last show. Before that show in October of 2020, it was a lot of trauma, darkness, COVID. And like I mentioned on last week, again, welcome back. If this is your first show back, tuning in, I had gone away for several months to work with COVID, to work in the COVID pandemic, both between New York City and here in Georgia and also in Texas. So that was a pretty traumatizing event, stressful event nonetheless. And today's guest, Dr. Anthony Joshua, knows all too well about working through that pandemic and helping people deal with stress. So now, do you ever get stuck in a negative thought pattern that you just can't shake? Maybe you're a person who deals with chronic pain, or you're often overwhelmed by anxiety and depression, feeling major burnout, where using techniques like meditation might help you improve your life. Plus, if clinical treatment options like therapy are limited or out of reach because of cost, there's so many free or low-cost resources you can use daily to build a meditation. So this is a very interesting topic for me because I always hear people talk about, even my own patients, say, well, doc, tell me about this therapy thing. I don't quite get it, or they even struggle with it. So we have Dr. Anthony Joshua on today to help me talk about this topic. Dr. Joshua, please introduce yourself and tell people about you.
Okay, I hope everyone's doing well. My name is Dr. Joshua Anthony. I am currently a psychiatry resident in Nashville, Tennessee. A few of my passions include addressing mental health disparities, as well as trying to decrease stigma in relation to mental health. I would really like to see mental health issues addressed more directly in our community, and I would love to see everyone, especially our community, be able to get the help that they need and to be able to progress towards a more complete healing.
Awesome. Well, meditation has started gaining more attention in recent years as a technique to help deal with anxiety and cope with stress. More recent studies have shown it as an effective treatment for people exposed to ACEs. Hopefully you saw last week's episode. Go back and tune in for adverse childhood experiences. Several studies have been conducted to understand the scientific benefits of this type of treatment approach. And today we are going to talk about how it can help you improve your general mental health. So it's funny, like I said, it's been growing. I got in the mail this past week from Psychology Today the high cost of calm. Why is relaxing is so much work? So I thought that was pretty timely that this came in the mail. And so we know it works. We know that it's a challenge, but it is a high cost. Like I was telling a patient of mine to download the Calm app. One of the there's LeBron James is on the Calm app. It's pretty dope, but you got to pay for it. He's like, a doc, this is $35. Yeah. And so he's like, I pay you $175, and I got to spend $35 to learn how to meditate to hear LeBron James. Like, where does like that cost kind of like benefit cost like kind of like weigh out? Right. So there are many definitions for meditation out there. Healthline defines meditation as the habitual process of training your mind to focus and redirect your thoughts. Headspace, a popular meditation app, defines meditation as a formal exercise to cultivate compassion and awareness, with these qualities being seen as the foundation to a healthy and happy life. Meditation itself is thousands of years old. The practice of meditation originated in South Asia around 5000 BC. The practice is rooted in spiritualism, but you don't have to be spiritual or religious to practice meditation. There are so many styles of meditation that come from different philosophies and spiritual traditions. If you Google types of meditation, please be prepared to be overwhelmed by the sheer volume of articles citing anywhere from 2 to 27 answers. So many ways you can meditate. It's about finding the right activity for your body, mind, and routine. At the heart of meditation is one core value: mindfulness, or focus and awareness on the present moment. And I would love to hear, as you have like grown in psychiatry and grown in mental health, and I think one of the things that's being like black and brown people, we got the title of being a mental health provider, or we got the title of understanding mental health in a very educational way, but we started this path, this journey of being interested in this kind of work, our people's stories, well before we walked into a classroom that allowed us to become licensed as a provider and practitioner. So how did you get interested in psychiatry and in mental health?
Yeah, so it's funny that you say that, because I think for us, mental health really is the story of like the culmination of our experiences, both individually and community, generationally. Things get passed down. If they weren't dealt with before, we have to deal with them now.
Right.
If we don't deal with them, then our children, those that come after us, will deal with them. So I'm probably not different from a lot of other people where in the community where, you know, I was exposed to things like the prison system at a very young age, through like my father who was incarcerated, or being exposed to family members that had drug issues or substance abuse issues. And so I think from there, I've traveled down the path of increased understanding, because when you're in it, I guess, you know, at the beginning, there's a lot of judgment, a lot of shame, and a lot of guilt. But as you begin to understand how different things come together, and how, you know, how experiences can really shape a person, it helps you to start having more compassion for people, including people who have hurt you in the past.
It's funny that you mentioned also about substance abuse, because a lot of times people don't often associate substance abuse with mental health, especially I think sometimes in minority communities. And I don't know if that's because we need to part and parcel it away so that it doesn't feel, so we don't put everybody in the same basket. But I myself also had an uncle who was using crack cocaine, struggles with drug addiction, like even today struggles with different type of substance abuse issues. And a lot of times individuals try to attempt to medicate away those voices in their head, those feelings that they're trying to avoid. So meditation and mindfulness, if had been introduced, could have been a possible way of coping with that. Or in other ways, like last week talking about ACEs, we talked about kind of like repeat trauma, and how I got into one of the people, Jacques, my creative associate, corrected me, because as I was talking to a former teacher, and she's a practitioner now helping, we were talking about the hippocampus, and kind of like those very kind of just irrational behaviors that kind of come out, as opposed to thinking about prefrontal cortex. And when people learn meditation and learn mindfulness, the ability to come out of that emotion and not get caught up in that kind of like reactivity that happens in that part of the brain, can take moments sometimes for people. So I'm glad thank you, Jacques, for bringing that up. And also, you know what? You are being incredibly modest, because you didn't mention at the beginning of this that you are actually very active in the mental health community and as a mental health advocate.
Yes.
Mm-hmm.
So I am pretty active, I guess. I'm a part of the American Psychiatry Association. I'm a current SAMHSA minority fellow.
Mm-hmm.
So every year they select fellows who apply to um, create a project or work on a project. They give you some money. And so I'm actually in the process of developing an app. So
Awesome.
yeah, so we're making a lot of progress on that. So
Uh-huh.
keep your eye out for that
Okay.
coming soon.
Okay. Okay. Now, is it geared to any specific community, any specific diagnoses, the app, or is it just a very broad or?
Yeah, so I will say up front, like, you know, for me, I do my best work when I work with things that I've had experiences with.
Mhm.
So for me, most of my work is geared towards black and brown communities because those are the communities that I grew up in. Those are the communities that I understand, and those are really the communities that are in a dire need of the assistance. There aren't a lot of people with mental health that look like you and I.
Mm-hmm.
Um, the app is geared primarily towards depression and suicide right now, but as time goes on, we're looking to expand that.
Okay, okay, awesome, awesome. So, the Mayo Clinic's page on meditation reports that numerous clinical trials have indicated meditation is effective in treating so many different disorders and diagnoses. I would love to find out, like, what are some of your like favorite resources to help guide meditation practice?
So it's funny that you mentioned the Calm app, especially because I don't think either of us are being paid by Calm.
No, no, not at all.
But that's actually what I've been using recently for meditation. For me, part of the reason is because over the last year, um, Headspace and Calm made their services available for free for healthcare workers.
Mm. No, I didn't know that. Okay.
Because we've been right in the thick of it. We've seen a lot over the last year or so. So that's actually how I started getting more into it. My wife actually started using Headspace, and I was not trying to get Headspace because I've tried meditation in the past, and like it's been difficult for me in the past, honestly, because my mind is always going. Even when I'm asleep, I'm always thinking. So getting to a space where I can kind of let go of all of those thoughts and just be still. That was difficult for me at first.
Hmm. You know, and I love the fact that you brought that up because most people would say, as mental health practitioners, these should come like normal to us. Like even before I started, so as a cognitive behavioral therapist is the type of work that I do. Even in my doctoral studies, found it very challenging to let some of those things go. Let getting out of my own head in some ways and just being present in the like what's currently going on was so challenging. And I like to talk to patients that we're trying to overcome challenges that happen to us as children. I mean, I was taught by my own grandmother and by my own parents. If you be ready, you don't. If you stay ready, you don't have to get ready. You know, But ready for what? What am I always anxious about?
Yes.
What is what is coming around the corner? Who's gonna get me? What's gonna get me? That I'm not gonna be prepared for. And learning to feel safe and learning to feel accepting what's going on right now is challenging for us, I think, as black and brown communities, especially as I feel like people who are struggling for seeking success, like how do I get there? What is my next move? If I'm not working, I need to be thinking about getting to that next rung in my life. And that can be useful and that can be very harmful.
Oh yeah, definitely. I think a lot of people in the black community who kind of been trained um, in the survival mode,
Hmm.
survival mindset, and I think that was good for a certain time. And most definitely, there are still situations where that is necessary,
Hmm.
um, but also um, it doesn't really lend itself, or rather, sometimes some of those same survival methods and techniques can be maladaptive
Hmm.
to being able to thrive.
Okay, yeah, exactly. It's maladaptive to thrive, but it's also in the same way is just it's just like how do I like also live in a because the truth is so I think the other part is that no man is an island. So
Right.
we're all like have partners, we interact with other people, and we also feed off other people's energy. You
Hmm.
know, so my partner may be a very anxious, which he's not. So I don't want him to like, I don't need an argument when I go home. It can
Understand.
be using this as an example, people.
Hypothetical.
Hypothetical could be a very anxious, on-ready individual. He's a flight attendant, and as a flight attendant, they have to always be paying attention to their surroundings.
Hmm.
It's not really like oh, I'm on the on the plane and that everything's going well. They need to be mindful of the 76 passengers that's on there, and the captain and the first officer and the other individuals. So if you live kind of like day to day, that's your norm. Sometimes learning to step away from that. One of the things is I have the Breathe app, and working with the Apple Watch that I love actually is that it will sense my heart rate and it can tell that my heart rate is like 110, so well above resting or a calm, and it will tell me take a minute and breathe. And I've been learning to follow that, learning to follow those prompts sometimes in life. So I'm really glad that that's out there. Now, do you have a specific example when you've seen meditation change someone's perspective on life?
Oh yeah. So in my training, I work a lot with veterans,
Mm-hmm.
um, people that have been exposed to combat, people that have been traumatized just in basic training,
Mm-hmm.
um, and a lot of times, like traditional like medication may not be working for them.
Mm-hmm. Mm-hmm.
Um, you know, and sometimes there's this level of frustration, like hey, I'm taking the medication, come to the therapy, these things are not helping.
Mm-hmm.
um, and I've seen several patients that have um, improved after beginning meditation,
Mm-hmm.
practicing mindfulness, um, and from my perspective, my opinion, when talking to them, just their entire disposition seems
Mm-hmm.
different. Like the way I guess they're moving from a place of reactivity
Mm-hmm.
to a place of being able to actually think through what they're feeling,
Mm-hmm.
identify what their feelings are, and then process that or let it go.
Okay. Okay. Well, in so back to like a little bit just more information. So in 2017, researchers Robin Ortiz and Erica Sabinga published a study called "The Role of Mindfulness in Reducing the Adverse Effects of Childhood Stress and Trauma." They reviewed numerous studies and findings related to ACEs, trauma, and the effect of mindfulness on the healing process. What they found was pretty remarkable. The negative impact of adverse childhood events and trauma in childhood is reduced by mindfulness. Mindfulness has been shown to mitigate the psychological, behavioral, and physiological changes associated with ACEs and trauma, increased allostatic load, specifically reduces symptoms of depression and post-traumatic stress disorder, like when you talked about soldiers, and we all know that sometimes in that particular type of work, their brain becomes highly reactive and emotional. Uh, Also, it's associated with poor health and behavior and biological markers of metabolic, neurologic, and inflammatory dysfunction and disease. Stress has been demonstrated to be associated with epigenetic modifications that may persist in our offspring. Therefore, mindfulness interventions may reduce these negative influence. What does this mean? Essentially, it means that mindfulness achieved through techniques like meditation can dramatically improve the mental health of trauma victims, including those with ACEs and PTSD. Not only that, it has a lasting positive effect. Trauma experienced by parents can have an adverse impact on their children, creating a cycle of unhappiness, suffering, and increased risk of chronic physical and mental health problems. Mindfulness has been shown to stave off these effects and have a lasting impact on the lives of practitioners. In other words, this medicine takes a long time to wear off, and if you keep up a consistent daily practice, you're setting yourself up for real and lasting healing. This translates to a happier and healthier life for you and your family. One of the things that got me interested in this particular type of work, I started out as a therapist, I started out as a nurse and then went into therapy because I saw the significance of one, learning my patients' stories, and I was always interested in hearing more about how people got to where they are. So when I did nursing and then went into social work, and everybody's like, well, why would you do that? Why would that, But I believe truly in what we call lifestyle medicine. I think that as as a healthcare practitioner, I would never speak ill of medications because they can be very useful. I've seen them both in my patients, not just working from the bedside, but in children who I could not work with without medication, literally jumping off the table, losing their mind, and the ability to slow that brain down just a little bit. I would love to hear about kind of like in terms of, because being a medical doctor, you have an MD and then you also have an MBA. What attracted you from the more Western style of medicine, as some would say, to kind of like a very holistic idea about healing, I guess?
Yeah. So for me, this question is actually pretty funny because I've I've talked to a lot of individuals recently that don't care for medications, especially in the Black community, and that is completely understandable. I grew up in a very naturopathic household, so we didn't really do any medications or anything like that. My mom barely wanted to take us to the doctor, so I know a natural remedy for almost anything at this point, and so I definitely see the merits. And then also my grandfather, he was born in 1912. He was alive during the Tuskegee experiments and all of that. He witnessed those things firsthand. So he refused to go to a doctor for anything. Did not trust the medical system, and so I'm very open to Eastern healing methods, especially the other part of that is just realizing where you came from as well, and I realizing the knowledge that we come from the East, and so I'm definitely always looking and find out more about those systems that may have been taken from us, because they were stripped from us when we came here. We had to adopt a way of life that wasn't necessarily natural for us, and we have suffered with a lot of trauma since we've been here as a result. So I'm always looking for things that my patients will be open to, because and you know this from working in the hospital, if your patient does not want to take medication, or does not want to interact, with the traditional healthcare model, then what is it that you can recommend for them? Like, you just tell them to go home and say good luck, or are you going to be able to recommend or suggest something else that can be to their benefit?
That one of the other positive things about this show today is we represent a very, let's be honest, small percentage of black and brown folks who are working in this particular area who are licensed to do what we do. What do you think are some ways that you help influence patients as a psychiatric resident that you know that I guess it wouldn't a normal practitioner wouldn't help, or like a family member say, you know what, Dad, you need to take your medicine.
Definitely. Yeah, so I mean, of course, representation is so important
Mhm,
across the board in all professions. Um, but also just that cultural competency.
mhm,
When I come in and I see my patients, they don't have to worry about being judged, about just being
mhm,
normal.
mhm,
You know, honestly, I've seen a lot of behaviors that are normal for us be pathologized. You know, inappropriate laughter, aggressiveness,
mhm,
you know, loud talking, things like
mhm,
that. And you're like, no, this person is just being themselves. Like,
mhm,
there's nothing pathological about this. Like, they may have something going on, but it's probably not, you know, something like schizophrenia. And you know, unfortunately, that has been one of the effects of not having enough providers that understand, you know, the background culture of many of their patients. Black people are diagnosed at a much higher rate for diseases like schizophrenia than their white counterparts, even though in actuality they probably um, have the disease at the same rate as white people.
mhm,
And so, you know, just being able to go into a patient and like see the relief on their
mhm.
face and
Right.
going like, oh, I thought I had to see a psychiatrist. Oh,
Mhm.
you are the psychiatrist.
Right, right.
Okay. And usually, you know, we just chop
Mhm,
it up. Like, you know, it's like an old friend most of the time
mhm,
when I get to go and see patients, and sometimes, you know, a lot of
mhm.
misunderstandings are clarified, and I love that about, you know, about this job.
Hmm. One of the important things you also just said about that representation is so huge. Research has now shown that individuals who tend to fare better in treatment and adhere better to treatment are actually those individuals who have somebody who sits across the table, you and I, who looks like them, talks like them, get where they come from. And that is unfortunately that is not easy because again we represent, I think I forget the statistic, one statistic that I looked at in the state of Tennessee, for every 26 individuals there is one mental health provider. So you say, look at, you make that, you stratify that, decrease that number and say, well, number of black individuals, mental health practitioners for black individuals, and you come up with like maybe 1 to 100,
Yeah.
you know. So that makes it even smaller. One of the things, but at the beginning of the show, you also mentioned was your wife was looking for a mental health provider in the state of New York or in New York City, and that was incredibly difficult to find.
Hmm.
You know, I'm a practitioner in the state of New York City and have been for a while, and that's just the reality of it all. Our practices are sometimes, unfortunately, overwhelmed. We also don't, to be honest with you, have like the same level of staff that that a lot of our white counterparts have established because their practices in some ways were handed to them by somebody else who was doing this before. I'll be honest, I have no mental health practitioners in my family. My mother has a master's in social work, but she worked in child welfare, and she worked with helping individuals who were underserved by like doing things like public assistance and stuff like that. So there are social workers who don't do mental health and different stuff of that nature. So it's like, who helped me who helped guide me.
Right.
Just kind of figured it out and put it in. Who helped you kind of moved into this kind of like journey for yourself?
Yeah, so definitely, you know, give a lot of credit to my mother, who raised me and my siblings. My mother is a teacher. Um, went to undergrad and then got her master's in education. And literally, I got to see her work in low income neighborhoods. And like she actually took time with her students. But not just that, like my mom is the type of person that like my mom has had people move in with us to like help them out. Like children, adults, and like try to get them back on track. A lot of times, our family be like hey such and such is acting up. I'm sending them to you for the summer, for the year.
Right.
And and they all know like like Maria doesn't play. That's my mother. But it's so funny because maybe a year ago I was going through like old photos from my grandparents, and I never knew this about them, but I found 2 certificates, and they were both techs in a psych ward
Oh,
in
wow.
New York. And like that was just mind blowing to me because when I was little, I don't remember them ever saying anything about that. But to see that and then to be like, man, I work in psychiatry now. That was mind blowing. So I think with my mother and definitely our family, I think we have had kind of this disposition or perspective of acceptance and healing because we've all gone through something. I think it's impossible to live here as a black person and not have gone through something. There's that quote by James Baldwin, to be a black man in America is to be in a constant state of rage. And I don't think a lot of people really understand what that means, especially the fact that we've been managing that so well for better or worse.
Right.
But yeah, and then definitely in the last 10 years, my wife has been very supportive, and has pushed me, has challenged me, just in a different perspective of understanding like the black diaspora, because my wife is West Indian, so 2 different cultures, and so I mean honestly it's been cool. It's been different, like like we bumped heads sometimes because it's like what, like you said what, you did what, like no, that's not
Right.
So but we both have a therapist, and that we go to, and our therapist even explained like within our communication, she said, Joshua, you being from America, the way that you communicate a lot of times is through your words. Like, so what you hear and what you see is that's what you get. But for a lot of people from Caribbean, their journey was different. There were certain things that weren't taken from them, so they also incorporate a lot of body language. So she was like, your wife is talking to you, but you're just not getting it. You're just not recognizing, language. And like once I got that, I was like, man, like okay, it's starting to make sense. So, it's been a great journey so far. I've enjoyed it.
And I'm sure there are moments that, even though we don't often call it mindfulness or meditation, that you, even after learning that, had to take a step back and kind of breathe.
Yeah.
Even in that moment, and breathe before I react, before we continue to go in this either argument or we get mad or offended by what the other says. I take a step back, I breathe, I think about what I'm going to say, and how to respond in a way that's loving, that's outside of my head. Because what I hear is you saying, and what I feel coming up inside of me is that anxiety and that need to lash back out, or that need to respond to either protect myself or or either hurt you. So taking that moment to breathe is being mindful, is taking a moment to kind of just say, now self, is this really that big? You know, is this really that painful that I am going to hurt somebody that I love, you know, just to get my point across or just to win? And that's meditation. That's mindfulness, you know, and being present in that moment.
Yes, yes, that is the essence of mindfulness, being in the moment. I think the two parts of mindfulness, attention and then acceptance, you know, really kind of sum up, you know, what mindfulness means. So paying attention to how you feel in that moment, and not just your feelings, like your bodily response. So if you're angry, like pay attention, where do you feel that at? Do you feel like tight in your stomach? Do you feel tight in your chest and your shoulders? Paying attention to, you know, just your overall state of being, is the first part of mindfulness. And then the second part, acceptance, is acknowledging those feelings that you're having and then releasing those.
Right, exactly. So one of the things I want to go on is an exercise that you can try anywhere. So what you want to do is basically you want to find a quiet place or wake up before everyone else in the house to get 10 minutes of quiet, peace and quiet. Find a comfortable seated position. You can also lie down and put your legs up on the chair or on the sofa. The important thing is that your back is straight. Start by taking a few deep breaths to clear your head. After a few deep breaths, focus all of your attention on your breathing and start counting your inhales and exhales. Do 1 for inhale and then 2 for exhale. Do this 10 times or more and then see how you feel. Another part that we spoke about earlier is that you don't have to be spiritual in order to accomplish this. Because some people is like, oh, well, that's Buddhism, and I don't believe in Buddhism. Or that's, you know, very ritualistic, and I don't believe in ritualistic type of stuff. And this is not linked to only spiritual or religious connotations, unlike what some other people would think. Yes, it is a significant part of some of their practices of Buddhism. I've never practiced Buddhism, let me say that much, but I know from individuals who just talk to me about their work. So I would love to see kind of where we are in this process. I know we're coming up on the end. How are we looking over there with like comments and stuff?
If I can just interject, I'll say, you know, whether you realize it or not, you are meditating on something.
Right, exactly.
Everybody meditates. So, you know, the problem is a lot of times we tend to meditate on negative things and we let those thoughts ruminate. And when we talk about, you know, meditation in a healing sense, we're talking about meditating on positive things. So you meditate,
right?
you know how to do it. You just have to, you know, change, you know, the subject matter.
Exactly. Well, we're gonna bring up your website right now, and because it's a pretty dope website.
Thank you.
Good job on that, by the way. I love it. So now, was there any inspiration for the direction of your website? I see mentorship being one of the significant parts of their advocacy, education, innovation. What was it?
So mentorship has been a big part of my life. I've been a mentor most of my life. So with my mother being a teacher, when I got a little older, a lot of times she would like bring me to her class to like tutor the students and things like that. Um, but then also as I was going through my career path, I realized that there's actually also a lack of mentors
Hmm.
for young black individuals. So I'm very interested in, or that's one of my passions is increasing mentorship. So everybody has the best chance possible to fulfill their dreams or whatever it is they want to achieve. And then advocacy, the community that I work in Nashville is primarily a black community. And during my time in medical school, I was really introduced to the power of advocacy, speaking up for people who may not be able to speak up for themselves.
Hmm.
A lot of times, things are as simple as, people are so busy working, they can't get to like these public meetings and things like that, and things end up happening. And we know that, with the social determinants of health, it's not just your health it's not just your health habits that determine how healthy you are. It's everything. It's the environment. It's how far is a local food source, things like that. And then innovation. I definitely think we always have to be looking forward.
Hmm.
Um, I'm excited about the way mental health is being embraced now, and that we're starting to see that change. I want to keep
Right.
looking forward.
Right. I want to get an amen for that because I'm so tired of this freaking narrative that black people aren't going to therapy. There are all kinds of examples. I'll be honest, my practice is full of black and brown folks who are intentionally seeking us out. Therapy for individuals who are some fellow clinicians of color are getting tons of, not to make a plug for therapy for black girls, but therapy for black girls being a resource where
I have them on my side.
exactly, where people are going to search, and we are really seeking out. These are becoming regular conversations, and I'm incredibly happy. So, Doc, we actually have a question from Rochelle. How does someone start meditating if they haven't done it before? What would you recommend?
Yeah, so I think um, you already suggested one way, start by finding a quiet place. I can tell you the way um, that worked for me because I had a lot of difficulty, especially like just sitting still for like
Mhm.
5 minutes. I'm like, no, I got stuff to do.
Right.
But the game changer for me is I was introduced to what's called Soundscape,
Mhm.
and I found out about it from the Calm app. I'm sure you can find soundscapes on YouTube if you want, but what they are just recordings of like could be like rain
Mhm.
or it could be water. So you can find a sound that actually relaxes you, and for me that like changed things drastically for
Mhm.
me. Like I felt significantly more at ease and at calm and able to focus on like my breathing,
Mhm.
to slow down my thoughts. So for me, that was one of the that was one of the big things that worked for me. Also, um, we have to realize that this takes practice.
Mhm.
So I think a lot of times when people think meditation, they think that you are sitting in one spot with your legs crossed, like this for 30 minutes.
Right. Right.
But the truth is, starting out meditation, you can start for 1 minute,
Mhm.
and then increase from there. Um, it takes practice, and as you practice, you'll get better at it.
Right. Another thing that I myself, when I actually started embracing mindfulness and meditation, was I just Googled guided meditation to have somebody's voice to help me, to guide me, because it was challenging. I mean, yes, sitting down, listening to white noise, is very useful after you kind of understand. But sometimes that voice to kind of like snap you and give you like what to do next, what to do now, like where you should be right now is incredibly useful when you're starting. So just Google guided meditation, Rochelle, and that's start from there using some voice. You know, another thing that these people are using is what's the woman who has like the incredible like it's like
ASMR.
ASMR, and she's eating pickles.
Okay. Said the cup. I was thinking,
She's like she
She
making
taps it with her nails.
she making buku bucks.
Yeah.
By the way, she making buku bucks. Shouts out to you, girl, for making your money. But anyway, that is it brings you, snaps you out of like thinking about the future, being focused on the past, and being mindful right now. People don't really understand. They're like, what is she doing? But just listening to that kind of like eating a pickle, or that like her rubbing on the microphone brings calmness. And that's really, really, really the main goal, is to bring a sense of calm. Also, like for individuals who are interested in going into mental health and different stuff like that, I know that you mentioned it, that you took advantage and had the luck. I also benefited from the SAMHSA Minority Fellowship Project to work on my studies as a mental health practitioner. I love that SAMHSA is recognizes the significance and importance of recruiting Black and brown folks to go into mental health, and that we don't have also sometimes the financial the financial means to be able to. SAMHSA's Minority Fellowship Project, I will put the link in the the comments on YouTube, so people know where to go to apply for that. They help individuals who are either like getting a master's, terminal degree, and whatever, or your doctorate or your medical degree, to go into working in this particular type of field, to help like combat this. So I think that's all we have time for. We're at our therapeutic hour for 45 minutes. So thank you again. We'll continue to talk and we'll go off.